Counting backwards from 100, it's the Medicare for the Lazy Man podcast. A podcast still searching for the real killer. He takes a half hour to cook minute rice. It's Medicare expert Doug Jones.
Hello again, everybody. Welcome to another episode of the Medicare for the Lazy Man podcast. This is your Medicare expert for today, according to my Canadian nephew, Drew McMillan. I am Doug Jones, and I'm here to make you feel confident that your encounter with Medicare is going to be nothing but profitable and rewarding. It's going to provide you with the best protection available at the least cost possible, equaling just the supreme satisfaction of knowing that you have superior protection. And that is the way I do business. That is the goal that I have when I take on a new client. And what do I do to help you with this process? Well, I encourage you to purchase one or more of my books, my Medicare books. And they are number one, the flagship of the fleet, Medicare for the Lazy Man 2025. That's available as a paperback at Barnes & Noble or at Amazon. At Amazon, it costs $11 for this paperback, but it's a very valuable resource because it will tell you about 89% of all the information that you may want, and the other 11% I can answer very easily for you when you ask me the questions that are remaining to be answered. And that comes in not just the paperback version, but also the Kindle version, which is very inexpensively priced at $4.50, the Audible version, which is priced at $6, and the hardcover version for those people who have a gift list to satisfy. You might as well give them a Medicare book and expect that they'll have that ready when they start to get to be Medicare age. That's going to be a $25 item. But believe me, I don't make any more on that hardcover book than I do on any of the other books. Now, for research purposes, I always suggest that people purchase my next book, Medicare Drug Plans, a simple do-it-yourself guide, a simple DIY guide. That's a $10 item in paperback and a $3 item in Kindle. And it's because the book is a kind of a workbook. It takes you by the hand and leads you through the government's website that allows you to select the best drug plan for you, and it allows you to apply for that drug plan right there while you're on the government website. It explains why these things are the way they are. It tells you about the mysteries that the government has created with that website, because they don't do everything perfectly. And it allows you to wrap up the encounter with that website by enrolling in the plan that is best for you. And what's the plan that's best for you? It's the cheapest plan when taking into consideration your drugs, your preferred pharmacies, and the area in which you live. So Medicare Drug Plans is available at Amazon, $10 for the paperback, $3 for the Kindle version. And finally, the most impactful book, the most powerful book of its size about Medicare has gone on sale recently and is called Medicare for the Lazy Man, Bare Bones. This is a paperback that costs only $4.60 or a Kindle that costs $1. And what does this book do for you? It answers the vast majority of the questions that come up when one is ready to enroll in Medicare. This book is a powerful book because it has only about 20 pages of instruction, but the activities it instructs one in are so vital to your Medicare enrollment and your Medicare transition that it's a no-nonsense powerful tool, and I suggest that maybe that could be your first of the three Medicare books to buy, because it will then open your mind up to thinking about the other elements of Medicare. And if you have intellectual curiosity, they can be that can be satisfied with the other books. If you don't really care, but you just want to get the job done, Medicare for the Lazy Man, bare bones is the way to do it. And speaking of bare bones, a guy is sitting across the screen from me who has several bones in his body. His name is Randy Carson. How the heck are you, Randy?
I'm doing good. How are you, Mr. Jones?
Well, I would have to say I've got a little more rotund fat on my bones than I used to have before I started this job. We were talking about your belt discovery. Uh,
Yeah,
Apparently, European belts are more user friendly to the portly gentleman. And
I'm
I'm,
telling you. I'm telling you, I've got a particular belt that I've never regret. I've only had it for, oh, I don't know, 3 weeks.
uh-huh.
Boy, I'll tell you, if I would have had this, 100,000 years ago, I would still be a happy camper using it because it is awesome.
Well, I've never been portly before, but I've put on some weight since I've been chained to my desk, and now I could probably use the belt as you were describing it as a ratcheting belt
A
buckle.
rat, yeah, it's got a ratcheting belt buckle that you can adjust it 1 millimeter at a time.
Oh boy. That's the way one cigarette brand used to measure its cigarettes. It's silly
Yeah.
milli longer. It was 101
Yeah.
millimeters.
That's right. You got it. But I got it. I'm never going to give it up. It's great. I love it. And the reason I needed it is because back in the day, I was a little bit on the bigger side than you, but I've lost, let's see, what have I lost now? I've lost almost 45 pounds.
Holy crap, how'd you do that?
Quit eating.
Oh, sounds like a rough way to go.
Well, the story behind it really was that I've been, let's see, for the last 2 years I've been involved up to my earballs in oral surgery.
Yeah.
So there was a lot of things going on there, and so I couldn't eat a lot of the times, other than just soft stuff. But bottom line is, it put me into a situation where I wasn't up every night, 2 or 3 times when I took the dogs out,
Uh-huh.
stuffing donuts in my face. And as
Well,
soon as I stopped that process, then the weight started dropping off, and then ultimately, recently, in the last, so when did I get back from Europe? 6 weeks ago, maybe 4
I
weeks
I didn't
ago.
cou- I haven't been counting the weeks. It was
Okay,
it was in June sometime, wasn't
okay, yeah, I think so. Well, I started walking
it? Okay.
about a mile a day, so it's continuing to drop my size down.
Well, cool. Very cool. That's very rewarding when you have that activity start paying dividends. I, on the other hand, used to be a skinny guy, and then I was physically active all the time. But when this Medicare thing started, when I said to myself, I can help people with Medicare, I can make a couple of bucks, and frankly, do some good at the same time. I realized one day that being chained to my desk is not allowing me to maintain my svelte former clothing sizes.
Well, the
So,
crazy thing about it was when I got to Europe this last
uh-huh,
time,
uh-huh.
I mean, I was absolutely shocked and appalled at my lack of ability to walk as well as I used to. I mean,
Really?
I was slow. I couldn't keep up with people, and part of that was, my breathing isn't as good as it used to be either. But
Uh,
bottom line, is that all put together? I thought, oh my God, I've spent too much time riding a desk chair.
well, I'm glad you caught on to that before it became fatal.
Yeah, yeah,
Because,
absolutely.
and if you're working on that walking, your stamina is getting better. I hoping you're
Yeah,
improving these things.
I started out I could pretty much a block, and down at
Yeah.
the end of my it's bigger than a block, but you know what I'm talking about.
Yep. Yep.
And now I've got it about a mile, about a half a mile each way up to the front gate, and so I'm going to continue adding on. But obviously, 118 degrees, it's a
Right.
little difficult some days. But I keep going because I don't want to give it up or start slacking off because
Well,
then
good for
pretty
you.
soon I'll be back at a 4,012 pound level.
Good for you. And frankly, I'm trying to figure out how I could translate that into my neighborhood, which is much smaller than yours, and the houses are closer together. But I live on the top of a cliff, And
Yeah,
so,
I know you
so
do.
walking down the first half of the walk is very pleasant. It's
Yeah.
the other part is the killer coming back up
Well,
the hill.
yeah, absolutely. And you guys that listen to the podcast often might remember that Doug, when he's in Arizona, which is where he belongs, by the way, lives in the Nosebleed Mountains.
Yeah, that's a steep area. By the way, there was a show on that we watched last night that stars the Property Brothers. They're trying another series having to do with real estate. This thing is House Hunters in the West, and the title of the series is Chasing the West. So it's going to play off of their. It's House Hunters without the Chinese lady who is dead now, but Suzanne Wang. But the
Yeah,
Property Brothers.
she's not as talkative as she used to be, is she?
Absolutely not. Absolutely not. But her English is impeccable. In
Yes.
any event, so the Property Brothers are Canadian, so their English is pretty good. But they show people around. Well, the people they had last night are actually contemplating coming to Cave Creek, where I live, up in the Nosebleed Mountains, but they can't
Yeah.
afford it. They're both TV traffic reporters, and they can't
Oh, for
afford
gosh
to.
sakes. Well, I know you got money coming out your ears,
Oh
but
yeah.
bottom line is, gee, many Christmas. Don't tell everybody that you're so rich, Doug.
Well, that's ancient history now, considering the fact that my property in Pugsleyville has cost me all the loose change and all the saved up money that I had. So that's a
Yeah, yeah. Doug bought this mansion out in
uh,
Pugsleyville,
uh,
and he's added to it, and now what is it you're adding to it today? A
well,
screened-in
screen
porch
porch.
with a
Yeah.
bar and a
Well,
portico, and what else is good?
with a cooler and hopefully an ice machine.
You don't have a portico?
No, I actually in the front we have a small portico. Now the prior house that was built by the heir to the Texaco and barbed wire fortunes, that was a
Yeah,
portico. That
that
was
was now
some
there was
portico.
a portico.
Yeah, that's right. Hey, I got to get to work here. I'm
I
not going
know
to
we
be
got
able
to
to
make some
pay you
money.
this week.
We got
So
to make money.
so let's do that. And I'm going to start by reading an article that happens to quote a study that was done. And the headline is straight from business school speak. It says Medicare Advantage headwinds dinging member satisfaction, according to a survey. Overall customer satisfaction with Medicare Advantage plans fell 29 points year over year, driven by declining member trust. And this is a JD Power study. So I'm hoping that it has some validity. Financial headwinds and policy changes in Medicare Advantage may have contributed to declining member satisfaction. Perhaps these people should start shopping for Medicare supplement plans. The main cause of the drop is a 39-point decline in enrollees' level of trust in their Medicare Advantage plans.
39 points. Holy bananas.
Yeah, they might as well all be Democrats. I mean, it seems like
Yeah.
they're following the same path. Once a steadily profitable line of business for insurance companies, Medicare Advantage companies have managed a dogged increase in medical spending since 2023 as Medicare participants sought out more care in the wake of COVID. The increase in medical costs has continued this year. Last month, executives at United Health, one of the nation's largest Medicare Advantage insurers, said they had significantly underestimated medical cost trends when pricing their plans, particularly in Massachusetts. So Humana and CVS exited markets and reshaped their benefits last year as they faced flagging profit margins in Medicare Advantage. Uh-oh. You know, the MA may not be Massachusetts. It may be Medicare Advantage. It was used twice in a sentence, and I expected that it would be something different when it was used twice so close together. So sorry about Massachusetts. My snickering was unwarranted. Meanwhile, the privatized Medicare program is also facing increased scrutiny from regulators and lawmakers amid reports that Medicare Advantage restricts care for enrollees and inflates government spending. Medicare will spend $84 billion more on Medicare Advantage enrollees this year than it would if those people were in traditional fee-for-service Medicare, according to a report published by the Congressional Advisory MedPAC. Now, the latest J.D. Power survey suggests that these policy and financial challenges could be impacting how members feel about their health plans. The report, which measured beneficiary satisfaction based on factors like their ability to access health services and how well plans resolved complaints, found that significant declines in member satisfaction with products and offerings and ease of doing business. Ratings in whether insurance companies offered products that met member needs fell 33 points year over year, while satisfaction with how easy it was to conduct business with their plans fell 31 points year over year, said the J.D. Power executives. New participants are particularly unhappy with their plans. Only 38% of first-year members said that their insurance met their service expectations, compared with 45% among established enrollees. New members cited challenges with finding in-network doctors and managing deductibles and prior authorizations. Well, don't look at me. I told you so. So the final paragraph in this article is top performing plans that invest in robust new member onboarding, increased transparency, new digital tools, broader networks, and social support services are proving that they are better equipped to maintain member trust and satisfaction even in a volatile environment. These digital tools in particular can help drive increased personalization, automated and more consistent onboarding, and increased transparency with real-time updates that members need. Well, that's, as we were saying earlier before the recording started, you play stupid games and you win stupid prizes. And it's
absolutely.
That looks like the way it is for people enjoying Medicare Advantage or failing to enjoy Medicare Advantage.
I do have a question for you, though, Doug.
Ask away, sir. Ask away.
So you're the expert. I'm not. But would it be a true comparison to say going into a highly costly, Medicaid, or not a Medicaid, but a medical procedure, just all kinds of possibilities with that. But would it be safe to say that would be like if you had a Medicare Advantage plan, that would be like going into that situation, taking a knife to a gunfight?
Well, from what I've heard, it's like not being able to find your knife at all because because it was taken away from you. So you basically don't have a knife or a gun to take that fight. And you have to ask the permission of the person you're going to fight to have any sort of weapon at all.
Yeah. No.
So it's bad. It's worse than you even that.
So I didn't even think of it. That's terrible.
Yeah, it really is. If you're going to have a fight with somebody, you have to ask their permission to hit them, and then they might say, "No, you can't hit me." But then if you appeal, if you fill out the paperwork and do all the steps, the many steps in the appeal process, then that person may come back and say, "All right, you can hit me now."
Well, there's one more, little acronym that I wanted to run past you to see if this is a true description of Medicare Advantage.
I can't wait.
MAD, M-A-D. You know what that stands for?
Mutually Assured Destruction.
Well, that's part of it, but I had it as Medicare Advantage debacle.
Yeah, well, that's exactly true. And apparently that article I just read indicates that debacle is getting worse for them. And I'm not particularly sympathetic to them.
No. I mean, I know you're going to say, oh, you shouldn't have ever said this, but headwinds. Every time the Medicare Advantage people have to be honest.
Yes.
They always, we're faced with headwinds.
Yes. It's like they all went to the same business school. I'll tell you, they sit around and compare notes. Here's a list of the terminology we're going to be using from now on. So it's like our secret code, but you're absolutely right. It's they all talk the same. I have an article in my stack of stuff. Thank you, Rush Limbaugh. That actually addresses that very subject. I may haul it out for addressing or for reading with the audience in just a few minutes. We'll see. Pain management is your Medicare Benefits 2025 selection. We've moved from the O's to the P's. So the last thing we had was oxygen devices or oxygen services. Now we're in the P's. This is the big book of all the stuff that Medicare might pay for or might not pay for. Pain management, Part B of Medicare, covers these services that may help you manage your pain and related issues. Acupuncture for chronic low back pain, alcohol misuse, screenings and counseling. I sometimes misuse alcohol when I spill it. I shouldn't ever spill my alcohol.
Have you ever spilled a drink, Doug? I mean, really?
Well, I've not since I've grown up and learned to be careful.
Oh, that's good. That's good because they're expensive. It's expensive stuff.
I have to husband my resources. Spilling alcohol is just not it's not prudent.
No, not at all.
So moving on with all the pain management things that Part B of Medicare will help you with your pain, behavioral health integration services, chiropractic services, chronic pain management and treatment services, depression screenings, mental health and substance use disorder services, occupational therapy, opioid use disorder treatment services, and physical therapy. If you have Medicare drug coverage under Part D, the plan may also have programs in place like medication therapy management programs or drug management programs to help you use prescription opioid pain medication more safely. So if you want to learn more about that, oh boy, this is a gut buster. Medicare.gov/health-drug-plans/part-d/plan-cover/plan-rules/safety-management-programs. I'll tell you right now, I did not know that there existed a URL that long, and that's you're going to have to rewind and maybe run it back slowly if you're interested in going to that URL, because I'm not going to take the time to repeat it again. We'll be way over our allotted time. So for the costs for most pain management services, it says you pay 20%, but of course, regular listeners to this podcast know that all you have to do is get a Medicare supplement from me, and that 20% goes poof. Let's see, if you get your services in a hospital outpatient clinic or a hospital outpatient department, you may have to pay an additional copayment. Well, not if you have a Medicare supplement from me, you don't. You pay nothing for a yearly depression screening if your healthcare provider accepts assignment. Things to know: there may be other ways to manage your pain. Your provider may recommend treatment options that Medicare does not cover, like massage therapy. If this happens, or if your provider recommends that you get services more often than Medicare covers, you may have to pay for some or all of the costs. Ask questions so that you understand why your provider is recommending certain services and if Medicare will pay for them. Would you like even more information? Well, I bet you do. I bet this is an exciting subject for you. Go to medicare.gov/coverage/pain-management. And they'll have all the information you could ever hope to possibly tap into. And other sources of help for Medicare enrollment. I would say that the last one is going to be the best one. But let me quickly run through the sources of Medicare assistance, especially assistance with enrollment that you're going to find here. State Health Insurance Assistance Program. We've talked about that. It's shortened to SHIP. That's an acronym. Randy is the master of acronyms, and that would be State Health Insurance Assistance Program. No, that's SHI, and then ignore the assistance. So SH, State Health Insurance Program. It offers unbiased one-on-one counseling and assistance for navigating the Medicare system. SHIP can help with various aspects of Medicare, including information on out-of-pocket costs, enrollment and enrollment periods, coverage, eligibility criteria, individual rights under Medicare. To contact SHIP, you can call this number, 877-839-2675, or you can use the SHIP locator to find and contact their local SHIP office. You can also go to CMS, the Centers for Medicare and Medicaid Services. That's a federal agency that provides health insurance coverage through Medicare, Medicaid, Children's Health Insurance Program, and Health Insurance Marketplace. That's for people under 65. Through these avenues, the CMS helps provide coverage to over 160 million people. It works with the healthcare community to improve the quality, the equity, and the outcomes of the healthcare system. So if you need CMS help, here's the contact information. To find assistance with Medicare, you can call 800-633-4227. The Social Security Administration, that is the part of the government that is responsible for enrolling people in Medicare. So while CMS runs the Medicare program, the Social Security Administration handles Medicare enrollment. I think I just said that. When a person is ready to enroll in Medicare, they will do so through the Social Security Administration. SSA can be helpful for finding information on various parts of Medicare, such as extra help, which is kind of a welfare thing. If you're poor and you need extra help paying for your drugs or your drug program, then that would be the kind of help that would assist you in that regard. Or if you are very, very successful and you are forced to pay the income-related monthly adjustment amount, which I call the success penalty, it's shortened to IRMA, then apparently they can help explain that to you as well. The SSA contact information is 800-772-1213. And the state insurance departments, each state has a state insurance department. These departments are helpful for getting more information about Medicare supplement insurance, which they call Medigap. I call Medicare supplement. Generally, each state will list the Medigap premiums each year for Medicare-approved private insurance companies. So what is the state insurance department contact information going to be? That will be, to find a local state insurance department, individuals can visit the National Association of Insurance Commissioners website, NAIC, and select their state from the drop-down menu. That's the National Association of Insurance Commissioners. And the Medicare Rights Center, that provides free independent online reference tool called Medicare Interactive. It offers easy to understand answers to questions that are frequently asked by Medicare beneficiaries. I've never seen this before. And the Medicare Rights Center telephone number is 800-333-4114. In summary, there are various options for individuals to find more information and assistance with Medicare enrollment, including SHIP, the SSA, and the CMS. State insurance departments can also help with information on Medicare supplement and Medicare resources. For more resources to help guide you through the complex world of insurance, visit our Medicare Hub. They don't tell me here how to get to it, but I would suggest starting with Medicare for the Lazy Man Bare Bones, which will cost you $1 if you get it from Amazon through their Kindle program. It's very easily acquired and very easily digested guide for those who are going to be enrolling in Medicare. And since I slopped over so much last episode, I think it's time for me to quit yakking and prepare to depart the premises.
Yes, probably so. So put your tray table up into its upright and locked position.
It will be up.
And be careful because your luggage and the overhead may have shifted.
That's what I was going to ask you about. Will those things have shifted or not?
Yeah, yes, they will. Definitely. I've never seen one fall out, but I've been listening to that for I don't know how many years I've been flying.
Someday it'll happen.
I've never seen anything fall out of the overhead, but bottom line is they keep saying it.
Well, it's like Adam Carolla says, when they tell you not to mess with the smoke detector in the bathroom, they tell you 3 different ways. Why can't they just say it one way? Don't mess with the smoke detector, but they say don't damage, destroy, or something else. They have 3 different
disconnect. I don't know. Bottom line is sometimes I just shake my head and go, okay, fine.
Yeah.
I I'll quit pulling the smoke detectors off, in the bathroom the next time I'm there. But anyway, long story short is there's several things I need to do to take care of it before we go ahead and close out for the day. And the first thing is grab your pencil, folks. Write this email address down, dbj@mlmmailbag.com. You can reach out to Doug any time of the day or night. He monitors that email address religiously 24/7. I don't know when he sleeps, but
I
he
don't.
does.
I spend the rest of the time watching sovereign citizen traffic stop videos on YouTube, and I swear I
All
can't
right. Well,
break
I'm
away
going to
from
send
them.
you some more stuff to watch, and it'll keep you up and going for days.
Oh, that's what I need. Insomnia.
Absolutely days. So next on the list is do not forget Doug is licensed nationwide, every state of the union to help you with your Medicare supplement planning. MedicareForTheLazyMan.com. That's our website where we take care of all our cool stuff and, take care of business for you also. Let's see next. We would appreciate it in your wanderings or your trundlings or your drivings or your flyings through the internet. Leave a review for us. We're still trying to keep ahead of the travelogue people, and I know that sounds really weird, but it's true. We're still trying to keep ahead of them, and so far we've won year after year. Last but certainly not least, thank you for joining us today. You could have been anywhere, and you were with us, which is exactly where we like to have you. But you never keep track of the time. You have just spent about 32 and a half minutes with Doug Jones, the anti-insurance insurance guy, originally from Oklahoma. No more. He's currently stationed in the low ground of Illinois in Pugsleyville at 758 feet. He's got so much oxygen to deal with that his cheeks are rosy and he doesn't have to breathe only about one time every 30 seconds.
And I can think
It's
like nobody's
amazing.
business. My
It's
brain
amazing.
power
It's
is
amazing. Yeah, it's amazing. Now, when he gets back home, which is where he belongs, up in the nosebleed mountains, it won't be that good.
no, but hey, that's better than not living in Arizona. Living in Arizona without oxygen is preferable. So anyway, ladies and gentlemen, you've been a wonderful audience today, and I sure do appreciate it. Please come on back and join us for our very next episode, won't you? Bye bye.